Today, we're diving into a real cornerstone of heart medication, Verapamil. You can think of it as a gatekeeper, one that controls one of the most fundamental signals in our entire cardiovascular system. It's all about a tiny ion that literally tells our heart when to beat and our blood vessels when to squeeze. All right, here's a quick look at our game plan. First, we'll talk about that signal itself. Then, we'll see exactly how Verapamil steps in to block it. After that, we'll check out where it's used, follow its journey through the body, and wrap up with the most important part, the risks and the absolute must-know safety rules. So to really get a handle on Verapamil, you have to first appreciate the power of a tiny little thing, the calcium ion. It's basically the master switch that controls almost everything your heart does, from the raw force of its pump to the steady rhythm of its beat. At its heart, Verapamil is what's called a calcium channel blocker, or CCB for short. And its entire job, its whole reason for being, is to stop calcium from getting into very specific cells in your heart and blood vessels. That's it. And this brings up a great question. We all hear about calcium for strong bones, right? But it turns out its role in our cardiovascular system is absolutely critical for every single heartbeat we have. Calcium is basically the body's ultimate go signal. When it floods into muscle cells, that's the trigger that makes them contract. We're talking both in the heart muscle itself and in the walls of your arteries. And on top of that, it's what carries the electrical signals that literally set the pace for your heart. Okay, so if calcium is the go signal, then Verapamil is the stop signal. It just steps right in and strategically flips that master switch to the off position. And how it works is actually pretty brilliant. So you've got calcium trying to get into a cell through this specific little doorway called an L-type channel. Verapamil comes along and just physically blocks that gate. If calcium can't get in, the cell never gets the signal to contract, so it just stays relaxed. Now, this one simple action has two huge consequences. For the heart itself, it means the heart rate slows down and each pump is a little less forceful. But for the blood vessels, it means they relax and get wider, which is what lowers your blood pressure and helps improve blood flow. So once you understand that basic mechanism, it becomes totally clear why doctors reach for Verapamil to treat a very specific set of cardiovascular issues. Its power to relax arteries is a direct hit against hypertension. By easing the heart's workload and boosting blood flow, it's a go-to for treating angina, which is that chest pain. And because it slows down those electrical signals, it's a key player in controlling certain kinds of fast, irregular heart rhythms. All right, so you take the pill. What happens next? Let's follow Verapamil on its little journey from your stomach all the way to the cells where it finally gets to work. Okay, here's a really fascinating quirk about how our bodies handle Verapamil. It gets absorbed really well from the gut, but on its first trip through the liver. This is a process called first-pass metabolism. The liver is so incredibly efficient that it just yanks most of the drug out of commission. So only a small fraction of what you took actually makes it into your bloodstream to do its job. So, to get around that first-pass issue and keep drug levels nice and steady, Verapamil comes in a few different forms. You've got an immediate-release version that gets to work fast. Then there's a sustained-release form that gives you a slow, steady dose over 24 hours for chronic conditions. And in a hospital emergency, there's an IV form that works in minutes. You know, the interesting thing about Verapamil's side effects is that they aren't random. They're actually the most logical thing in the world. The drug is just so good at its main job, blocking calcium, that it sometimes does it a little too well, or in places we didn't exactly intend. Constipation is the #1 side effect, and it makes perfect sense, right? The drug is relaxing the smooth muscle in your blood vessels, but it's also relaxing the smooth muscle in your gut. Dizziness? That's just the blood pressure dropping. That swelling in the ankles is from changes in pressure in your tiny blood vessels. And of course, a slower heart rate isn't just a side effect. It's a direct effect of the drug doing its job. But, and this is incredibly important, it's vital to know when these effects cross the line from helpful to harmful. A good drop in blood pressure can become a dangerously low one. Easing the heart's workload is great, but it can actually make pre-existing heart failure worse. These are red flags that mean you need to get medical help right away. And that brings us to the most critical part of this entire explainer, the non-negotiable safety rules. There are some situations where Verapamil is just completely off the table. Giving Verapamil to someone who already has severe heart failure or extremely low blood pressure could make things catastrophically worse. The same goes for certain electrical problems in the heart. In these situations, the risks just massively outweigh any possible benefits. It's a hard no. On top of that, because verapamil is broken down by a really key enzyme system in the liver, it can have serious clashes with other drugs that use that same system. If you combine it with beta blockers, which also slow the heart, you get a dangerous double-down effect. It can also cause the levels of other common drugs like digoxin or some statins to climb up to toxic levels. And really, this quote just says it all. The bottom line is, verapamil is a powerful, effective tool. But because its effects are so strong and it interacts with so many other common drugs, it absolutely has to be prescribed with deep knowledge and a ton of care. So, when you step back, the story of verapamil is a perfect example of this amazing idea in medicine, that by targeting one tiny molecular channel, you can fundamentally change how an entire system in the body works. It really makes you wonder, what other master switches like this are out there, just waiting to be discovered?